Hello, my name is Sarah and I'm a scientific manager at Anti-Doping Denmark. In today's poster session, I will present the project No Pain, Just Gain. Painless, easy and fast dry blood spot collection from fingertip and upper arm in doping control. This project was conducted in collaboration with the University of Copenhagen and the Norwegian Doping Control Laboratory with funding from WADA. So the dry blood spot technique is about to be implemented in doping control and allows for the collection of microvolumes of blood in a minimally invasive way. Today, several devices is on the market, and with those, it's possible to collect dry blood spot from different anatomical sites. The possibility to use different devices in doping control will depend on the athlete's experience and the experience by doping control officers and laboratory staff, as well as a good agreement in analyte concentrations between sampling sites. So in the present study, we had 11 doping control officers from Anti-Doping Denmark collecting samples from 108 athletes from different sports. Dry blood spot was collected from the upper arm using the Testosterone M20 device and from the fingertip using the HemaSpot HF device. And after sampling, the athletes and DCOs were asked to evaluate the procedures. The samples were transported to the laboratory where the laboratory staff evaluated the quality of the samples and quantified the endogenous testosterone levels in the samples to compare and determine whether there's a difference in endogenous testosterone levels between sampling sites. Here you can see the rated pain and general experience rated by the athletes on a scale from 0 to 10, with the dark gray columns representing upper arm and light gray finger prick. In general, the pain was rated low and the experience as good for both sampling sites. But following upper arm collection, the pain was slightly lower and the overall experience slightly better than after finger prick collection. For the DCOs, the experience was rated also slightly better following upper arm compared with finger prick collection. 1 week after sampling, we contacted the athletes again and asked them to determine which sampling site they preferred, also taking into account if the sampling had had any influence on their training and competition the following week. Out of all athletes, 78% preferred the upper arm collection. And out of the athletes dependent on hand and arm when performing the sports, 86% preferred the upper arm collection. We also asked all athletes who had been tested before whether they would prefer dry blood spot, upper or dry blood spot, venous blood or urine sampling. And 96% would prefer dry blood spot collection. When it comes to the quantification of testosterone, we saw a good correlation between sampling sites. Also, similar descriptive statistics between the sampling sites with no significant differences between the means. The developed method showed high sensitivity and we were able to quantify low testosterone levels, even low endogenous testosterone levels in women. When plotting, making up land endpoint plots with the difference between the measurements against their means within each individual, we could calculate a bias of minus 7.45%, negative for Testo. This is not a large bias, and it seemed not to be due to a physiological difference between the sampling sites, but rather due to unsatisfactory volume control of the HemaSpot device compared with the Testo device. Because the laboratory staff, they reported that there was some excess blood or flakes under the HemaSpot device. This was also one of the reasons why the laboratory staff also preferred the Testo device compared with the HemaSpot device. So to conclude, the athletes prefer dry blood spots over urine and venous blood sampling. Athletes doping control officers and laboratory staff slightly preferred upper arm collection compared with finger prick dry blood spot collection. Collections from both sampling sites were associated with minimal pain, with slightly less following upper arm collection. We were able to quantify low testosterone concentrations in dry blood spot, meaning that also low endogenous testosterone levels in women can be quantified in dry blood spots. In the present study, we saw no detectable sampling site dependency when it comes to testosterone concentrations in dry blood spots. So, based on our results, it seems like both sampling sites can be used in doping control. This novel information will guide the drafting of new regulations to be used in doping control for collection of dry blood spots. So in the end, I would like to thank all investigators, doping control officers, athletes, and laboratory staff for their contribution, and also to WADA for funding the project. Thank you very much for listening.